We will first begin our assessment with a health history. The nurse should observe the level of consciousness. The patient should be alert and awake with eyes open, looking at the examiner. The nurse will assess the symmetry of the face, including the eyes and the contour of the mouth, making sure they are equal bilaterally. The nurse should check that the client can blink both eyes, does not have slurred speech, is aware of orientation, and can grab and squeeze the first 2 fingers of the nurse's hands.
I'm now going to check the symmetry of your face. Can you please state the name of this hospital, the date, and the time?
We are in the sim lab. It is November 20th, and it is 2:30 p.m.
Good. Now can you please squeeze my nursing student's fingers to check for muscle tone?
Excellent. Your muscle tone is equal bilaterally.
The nurse will next check the plantar flexion and dorsiflexion strength to see if it is bilateral.
She is now going to check the plantar flexion and the dorsiflexion of your feet to make sure it is bilateral.
Please press down and flex. Good. Very good.
The nurse will now see if the client can obey commands.
Can you please touch your nose with your pointer finger?
The nurse will now check for direct and consensual constriction, making sure that the client's pupils meet the Pearl criteria.
See my pen light. Could you please look straight ahead? Good. Excellent.
The nurse will now check the 6 cardinal fields of gaze.
You could please follow my finger.
Lastly, the nurse will now assess the client's balance. The client should be able to walk heel to toe with little difficulty in an upright gait.
Can you please just walk a couple steps, heel to toe?
Excellent.
The neuro assessment is now complete.